Hello, and welcome to this video about the Mecklenburg County Health Department Community Health Worker Initiative. This video will walk you through a system map for the Mecklenburg County Health Department's Community Health Worker Initiative. This map was produced by evaluators from Partners for Impact, who used interviews and other basic data collection for evaluation and the development of a comprehensive plan associated with this Community Health Worker Initiative. This particular system map will help you understand the multiple moving pieces in the Community Health Worker Initiative and how this intervention fits into the overarching goal of improving health outcomes for people across Mecklenburg County. Part 1. Factors of Health Outcomes. We're going to start by thinking about health outcomes and acknowledging that there are three factors that influence health outcomes. The first factor is individual behavior. We understand that our level of exercise, the nutritional quality of the food we put into our body, whether or not we smoke, the amount of sugar that we consume, and many other individual behaviors impact our health outcomes. We also know that accessing clinical care is another important element in health outcomes. Do we have a primary care doctor? Can we access the prescriptions that the doctor may prescribe? If clinical care is not accessible, it becomes much harder to stay healthy. Then the third element is what we call the social determinants of health. These are aspects of our living conditions that impact our health. These include where we live, the housing that we may or may not have, the transportation that we may or may not have, and the type of food that we can access. Is it healthy? Is it not? These are elements of our social well-being that impact our health outcomes. Unfortunately, we know that there are disparities within health outcomes. Underserved or marginalized communities tend to have poorer health outcomes. For example, in the health assessment that was done by Mecklenburg County, they discovered that the mortality rate for African American infants is 3 times higher than the white infant mortality rate. Vulnerable populations, such as those who live in poverty, those who are uninsured, those who are unstably housed or homeless, people living with disabilities, and people who don't understand the language can be marginalized and underserved, which compromises their health outcomes. Part 2. Community Health Workers. One of the strategies that the Mecklenburg County Health Department has used is to identify a specific type of public health professional called a community health worker. A community health worker emerges from an underserved community, understands the cultural nuances of the community, and is a trusted member of that community. Because of this connection to their community, a community health worker is better positioned to actually share information about health behaviors. They can help individuals in that community connect to primary care physicians, and they can help them navigate the complexities and paperwork associated with obtaining clinical care, especially if there is a language barrier. They can also help patients access things like food, housing, and transportation. Although a community health worker can help patients to access resources, that service depends on resources being available for patients to use. If the needed resources don't exist in the community health worker is then unable to improve patients' health outcomes in that particular. This makes community resources an integral part of the Community Health Worker Initiative. Without community resources, the initiative cannot create improved health outcomes. The more resources are available in a community, the more we can reverse the underserved nature of some of these communities, and the community health worker is more empowered to direct their patients to the programs and resources that can improve their health outcomes. Part 3. The Community Health Worker Initiative. In order to support and promote community health workers in Mecklenburg County, the Mecklenburg County Health Department focused on 3 specific goals. The first one is the technical training and continued professional development of community health workers. Community health workers can access certification programs through community colleges. They can also learn from each other. Community health workers who have been working in the field for a long time can serve as peer mentors for those who are new to the profession, and employers can provide professional development resources. This first goal is about how we improve the skills and training of community health workers who are helping to improve health outcomes in marginalized communities. The second element is employers. Community health workers need a supportive work environment, especially as employees who are providing support in turn to their communities. A critical part of a supportive work environment for community health workers is valuing the lived experience that community health workers bring to the table. Remember that community health workers have a shared lived experience with many of the people who live in their community, which is a unique perspective that other health professionals can't provide. When employers value that lived experience and community health workers become a part of patients' healthcare teams, a community health worker can help doctors fully understand the situation their patient is experiencing. Their lived experience makes them a valuable member of the team, but they require support in different ways than other health professionals. Providing a supportive work environment means creating a path for professional development for community health workers. It means helping community health workers learn about and understand the community's resources such as food and housing. Because community health workers may be dealing with the same housing and transportation disparities as other members of their community, employers also need to make sure that community health workers receive the technology and transportation they need to do their work effectively. The third goal involves revisiting the concept of community resources. It's important to understand that these community resources involve individuals, organizations, and institutions which make up the larger ecosystem of community supports and influence the number of resources that are available. Let's take housing, for example. Struggling to obtain consistent, safe, and supportive housing is a common problem for some of the patients that community health workers are assisting. Obviously, housing concerns are a bigger issue than just within the community of patients that community health workers tend to. And within a city or county, there are other organizations, institutions, and county and city governments that can impact access to housing resources. These organizations can invest in affordable housing across the community that would make it available to more people. Within the context of the Community Health Worker Initiative, our third goal involves thinking about how to mobilize and create the resources that community health workers and their patients need. It means identifying those gaps very specifically and creating a plan of advocacy to bring these resources into the community so that the social determinants of health for marginalized communities improve, which in turn improves these communities' health outcomes. In summary, the three overarching goals of the Mecklenburg County Community Health Worker Initiative are to 1. Improve the skills and training of the community health workers. 2. Make sure that they have a supportive work environment. And 3. Make sure that communities are developing and getting the resources that community health workers need in order to make good referrals for the patients they are working with and, in turn, improve their access to care, their social determinants of health, and their health outcomes. This system map is in some ways oversimplified, but it demonstrates the primary moving parts in the complex system in which this initiative operates. Hopefully, you now understand that this initiative requires support from many institutions, organizations, and individuals. It takes the investment of the whole community to really create the changes that we want to see in health outcomes for people in Mecklenburg County. Thanks to Partners for Impact for designing this system map, and their design consultant Fiona W. Dunn for her creativity in developing the map, and to Keela Marlin at the Health Department. If you have any questions about how to develop a system map, the systems mapping process, or the Mecklenburg County Community Health Worker Initiative, please reach out to the Community Health Worker Initiative via their email, chwi@mechnc.gov. And thank you for taking the time to watch this video.